Next, bridging the gap between science and spirituality to treat mental illness in India. Fred de Sam Lazaro has this report, part of our Agents for Change series. It also aired on the PBS program Religion and Ethics News Weekly.
This tomb of an Islamic figure revered here in Western India, martyred 500 years ago, has long been a pilgrimage destination. Thousands of faithful, not just Muslims but also Hindus, Christians, Sikhs and others from across India, come here each day to pray for a blessing or a miracle. Couples unable to conceive, people suffering from various maladies. It's also the closest thing for many Indians to a mental health facility. It is a taboo subject, the stigma especially hard on families of people with mental illness, treated as a curse, a demonic possession, or karma for misdeeds of a past life. Syed Varis Ali is a trustee of this shrine.
The people who come here with mental illness, they have tried everything else, and they have not gotten any relief. And finally, this is the place they come to. They come here to pray.
At this shrine, dozens of faith healers called khadims recite prayers while patients perform rituals, breathing in smoke from incense burned at the tomb, walking around this dome 7 times.
The numbers in India are simply staggering. There are thought to be about 100 million people in this country with common mental disorders and up to 20 million with severe mental illnesses such as schizophrenia. For all of them, there are about 5,000 psychiatrists in this country.
So faith healers from across India's diverse religious mosaic have long filled the gap, says Milesh Hamlai, a well-known mental health advocate.
Access to care is not there, lack of professionals, lack of medication, lack of awareness, lack of knowledge. So all this leads to only one thing, that you go to the easiest and the most available source of help. I come from an urban India, so in spite of that, my family took my brother first to such kind of places.
Hamlai, who comes from an educated middle-class background, became an advocate after his brother came down with schizophrenia several years ago. He discovered there are some resources provided by regional government hospitals, but they aren't well known or utilized in a historically inefficient system. So Hamlai brought state mental health officials, led by Dr. Ajay Chauhan, to the shrine.
When I came here, there were 40 to 50 faith healers standing in the door to keep us from entering. They thought doctors were coming to put them out of business. It was a very sensitive time, especially since this is the Muslim holy place and there are several thousand jobs at stake.
Eventually, perhaps with the implied threat of legal action, they were able to enter. But Dr. Chauhan says they reassured the shrine's leaders they had no intention of shutting it down. He says conditions they saw, though, were appalling.
There are 40 to 50 people chained up to a post, often because they've had violent episodes. Some were abandoned by their families. Conditions were very unhygienic and completely inhumane.
Things have improved markedly. India's Supreme Court outlawed mechanical restraints. Chains are used now, but only symbolically and not as restraints. And under a partnership brokered by Hamlai, the shrine allowed psychiatrists to set up clinics inside and just outside the premises. They also began to train faith healers to look for telltale signs of common mental illness. Khadims like Said Dumia Mahmood Ali see such symptoms, like those of 23-year-old Javed, through a very different therapeutic lens.
Somebody has performed black magic on him. I can tell by the way he is sulking and down.
But after a session of ritual and prayer, Ali brought his patient to see his psychiatrist tag team partner, Dr. Yatin Bhushan.
He says he's been having physical problems, so I thought I'd bring him to see you.
Javed complained of leg pain, but as the conversation went on, there was a longer litany.
I don't sleep because Vikas comes.
Who's Vikas?
A man. He says, come with me. Every day.
After clarifying with his parents that there was indeed no real threat to Javed, Dr. Bhushan renewed a prescription for the anti-schizophrenia drugs. Javed's mother, Saira Banu, said his condition had improved after he began taking them.
He sleeps now. He never used to sleep through the night. Before he used to hit us, but now he's stopped doing that.
I'm going to give you 15 days medicine. See me again after 15 days or if you have any problems. And also do what the Khadim says.
Psychiatrist Bhushan is careful to acknowledge his faith-based partner. Pills, for example, are routinely blessed in the shrine's inner sanctum. Dr. Bhushan says this reaching out is mostly, but not always, reciprocated.
Some Khadims tell patients that the medicines are not needed, or that they can stop taking them.
We've spent a lot of money and to no benefit.
Javed's parents, laborers from a city about 2 hours away, struggled for 5 years with their son's illness before finally getting results.
So everyone was telling us to go to the Mira Datar Dargah, where they could treat this problem of black magic. So we came here. Then they told us that they had this medicine program as well.
I asked, is it the medicine or the prayer that's working?
Both are working.
Milesh Hamlai is not surprised by that kind of response. He says there can be therapeutic value in pilgrimage to this shrine.
It's a place to pray. It's a holy place. They're finding some kind of solace. At least that is trying to bring them back to normalcy. And in that, if we are able to provide them with medical intervention and proper care, counseling, listening, I'm sure they really feel very good that there is some place where they can go and offload themselves.
So far, Hamlai's group, called The Altruist, has managed to bring some 16,000 patients to the program called Dawa Dua, Medicine and Prayer. It's a tiny number amid vast need, but some experts say a promising prototype to expand psychiatric services without disrupting or antagonizing age-old belief systems.
Fred's reporting is a partnership with the Undertold Stories Project at St. Mary's University of Minnesota.